Hello, health enthusiasts, and welcome to RevUp Health, your go-to podcast for all things wellness. I'm Dr. Mark Hechler.
And I'm Tandi Hechler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome to RevUp Health Podcast. I'm Tandi.
I'm Dr. Mark.
And today we are so excited to be coming to you from our new clinic in our tiny little clinic in the woods. We can't wait to start sharing it with people. We are going to have an open house on May 11th from 10 to 1. So keep that on your calendar. If you're in the Kansas City area, we'd love to see you and show off our new space. Today, we wanted to talk a little bit about something that has been coming up a lot. It's interesting when we see folks, sometimes it feels like we can be a little bit overwhelming because we've got so much to tell people and so many things that people can do to improve their lifestyle and in turn improve their health. And so one of the things that Dr. Mark says quite frequently is that he follows the 80-20 rule in his habits and lifestyle. So we've done a little bit of research and we know there's more than one kind of look at this, but we'll talk about what Dr. Mark means when he says he follows the 80-20.
So 80-20 can be a multitude of things. Obviously, at this point, you can throw anything into 80-20 rule and it just literally will apply. But what I like to do is basically what my main thrust with my 80-20 rule is basically with my diet. So that means, all right, 80% of the time, I'm going to try to eat as healthy and as clean as I can and be very aware of the carb intake, how I'm eating and what I'm eating. And then 20% of the time, I don't have to be so careful. There's 20% of the time is my cheat time. That's the time when I may, have my latte or have my desserts or, have things, chocolate, obviously, things that may not be the best for us and for our health, but yet they're good to take and good to taste and eat and drink. And that even means a glass of wine. I'd throw that into the 20% time too. You really shouldn't have alcohol that much. So I try to keep with the 80-20 rule. And if you can do that in general, you're going to help improve your overall health quality and give your body a chance to heal and repair and improve your performance and quality of life.
Yeah, I think this is so important. And like I said, it seems as though we're coming at people with all these things, opportunities that there are to make improvements and change habits and lifestyle. So this really gives people that unwritten grace to know that you don't have to be perfect. And that is so key. Anything you can do, any habits that you can add in will be on a road of moving you forward, but you do have to start and kind of pick out those little things that you are going to really work on. Another thing that has come up lately that we kind of have a hard time with, because Dr. Mark also likes to say, like, it's a priority and this is a priority and this is a priority. And I am always saying, if everything is a priority, then nothing is a priority. Like, you have to pick right now, what are some things that you can do to be your priority? What are your thoughts on that?
I'd say that it's all important and it's all should be a priority in life. So if you do that, try to focus on that 80% of the time, then the 20% of the time, it won't be the priority. So you don't have to worry about it. So that falls into the 80-20 rule. But, you're looking at something where, 80% of your consequences occur from 20% of your experiences. So that's kind of broad, and you can take that however you want and run with it. But that 20% of the time that you may be messing around doing the things that you shouldn't be doing, for instance, and maybe that affects 80% of your health habits too. I don't know the answer to that question, and certainly there's studies out there probably will look into this stuff, and there's probably been 1 million people that talk about that on social media and all too. So, but what basically it boils down to is just trying to do the best you can, and like Tandi said, if it's just one thing, do one thing. Don't do everything. Do one thing at a time. One little step, one little thing you can do now will help improve what your overall health is going to be like. And same thing with running a marathon. You know, a little bit at a time, mile at a time will finally get me up to 26 miles. So it's the little stuff that'll create the big moving experiences for your health later.
Yeah, I think it's important to just think about it as kind of chipping away at those things. And some things may come really easy, and then you get that habit instilled into your day-to-day pretty quickly. But they say that it takes about 21 days to really get a habit into where it's just part of your lifestyle. So even if you say, you know, this month I'm going to work on getting to bed earlier and, you know, improving my sleep hygiene, and really work on that and let that be your focus. Let that be the priority. And then the following month, you can pick something else. And as you kind of go through, you're making these big changes. But even as you're implementing things, do not expect yourself to be perfect, because we are all human and none of us are ever going to meet that mark of perfection.
Even with exercise, you know, you can do a lot of different things to try to improve your health quality, but you don't have to do the most aggressive, physically demanding exercises all the time. Literally, studies also show that, you know, zone 2 exercise is something you should be doing 80% of the time. And the other 20% of the time, you can do the other heavier, more strenuous exercises. Or, you know, do the other 20% of the time doing nothing, just walking, enjoying nature, and getting out and enjoying the fresh air and the flowers and the birds. So that 80% of the time, you know, try to do something that's actually going to be beneficial. So you can really increase your VO2 max, which is basically your body's ability to transport blood to the cells. That's going to improve your overall endurance and health quality too, with just simple zone 2 exercise, which is exercise basically where you can carry on conversations during that exercise. And it may be different for everybody. Maybe it's just walking that you need to do. Maybe some people can go out biking. Maybe some people can run. I mean, it's just something that you can do 80% of the time.
Just while you were talking about zone 2 and the importance of doing that 80% of the time, I think it's just important to note that for women, as we age, doing these big, extreme, heavy workouts, that kind of workout doesn't work as good for our bodies anymore. So that's another just little tidbit of information. Yes, that's a whole nother podcast, but so ultimately, we just wanted to get on and discuss the fact that when you start a lifestyle journey, a health journey, there are going to be a lot of things that you can do and need to do to improve your overall health and make big impact in how your body feels. And we just want to make sure that people don't get overwhelmed with all of these things. Remember, it is anything that you can do will help to move you forward.
Yeah, no matter where you're at in your health journey too. There are some folks that have just decided, okay, I'm doing nothing good for myself. I'm feeling awful. I'm feeling fatigued. You know, I don't get good sleep. I don't have a good relationship in my family, or I have no libido. I mean, there's all kinds of things. So whatever a person can start to do now, and whatever phase you're at in your health journey will help you later. So pick small things. Pick one or two things at a time. You don't need to do everything at one time. You're going to have trouble with that, and it's going to set you up for failure, and then you're going to get disappointed in the fact that you maybe have not done what you need to do. So start small, pick little things, make that a habit. Start something that you can do for a couple of weeks, and then if you can do it for a couple of months, it is a lifestyle change.
Yes, there is a great book, James Clear, called Atomic Habits, and it's a great read to help you learn how to get new habits going in your life. And there's lots of tips and tricks. We could probably, again, do a whole podcast just on that book and kind of some of those tips and tricks. But one that I have recently used is habit stacking. So I love our mornings when we get to sit and have a cup of coffee together and kind of relax before we get our day rolling. And I know that I need to hydrate better. So I have habit stacked where I have to drink a cup of hot water before I will let myself have a cup of hot coffee. And so that's just an example of how you can take something small and kind of integrate it into your day. And then all of a sudden you've got a new habit that's helping you move toward your goal. So I'm looking at Mark and he's thinking this is pretty complete. So anyway, we just wanted to get on here and let people know that even though sometimes this can seem overwhelming and like it's an impossible journey, give yourself grace. Remember to take things slow, pick certain things,
and develop a lifestyle, because this is about your health, not someone else. You may think, okay, well, I'm going to do this for my spouse, or I want to get healthier for them, but do this for yourself. So if you can do things that will help yourself, then you're going to be more productive, and you're going to be there for your family members to help them out. It's something as simple that, doing daily activities. Of course, if you can do anything you can to help improve your overall strength and quality of life, well, then you're going to be available for your own family to help them and care for them and nurture them too. So start small, develop your lifestyle changes, and I think you're going to find out that this journey of health improvement and health care is better than disease care that you'll have.
Yeah, one other thing along those lines that I have also been thinking about, I just recently listened to a podcast by Mel Robbins where she was talking about happiness and how you can kind of use a portal, so to speak, of looking at a time in your life when you were happy and looking at where you are now and finding the clues from where you were happy and bringing them into your current life. And as we think about longevity and what we are trying to promote with Revelation Health and Wellbeing is creating a life that will carry you into old age. So think about all the things that you do right now that keep you happy, that you love to do. And how are you going to be able to continue to do those things later in life so that you can just take those tools with you as you age? So that's another little piece. And that could help you prioritize, like, what is the thing that I want to be able to do later in life because it makes me so happy now. And although it comes easy to me now, it might not as I age unless I work at it. So I think that's another good thing to look at as you're picking what you're going to work on first.
So we thank you for listening to us here again on RevUp Health, and we hope that you've gotten some information and get excited and get motivated so that you can move forward and improve your quality of life and help the others around you. So if you have any questions or comments, just reach out to us here at revelationhealthandwellbeing.com, or we're on Instagram also. But we want you just to have a good life and have a great day.
Thank you for tuning in to another episode of RevUp Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to RevUp Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from RevUp Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.